I wonder if we could start by getting a sense of the size of the COVID problem and outbreak in Africa. Some studies have suggested in the past couple of months that there is vast undercounting of COVID in some places outside of South Africa. How concerned are you about that?
Thank you, first of all, for having me on your program. The burden of COVID in Africa is huge. I mean, as we speak today, the continent has reported officially slightly over 4 million cases of individuals who have been infected with COVID. But we certainly know that that is an underestimate, because the serologic studies, which are studies that are conducted to determine if people have been exposed to the virus and have antibodies to the virus, do show that in settings like Nigeria, Zambia, that there might be a significantly more number of people that have been infected. But the key characteristics of our pandemic is that many people have recovered from it, and that very young people are infected, but they really don't get sick. In our own setting at the Africa CDC, over 20 young people have been infected, and nobody has been hospitalized. So I think that is one unique feature of the pandemic in Africa.
What is the best way to vaccinate people in Africa, Dr. Nkengasong? Is it through Covax? Is it through African countries doing their own bilateral deals with drug manufacturers? Or is it a mixture of both? What is the best path?
It is a mixture of both. The head of states have agreed on a common target that in order to get out of this pandemic, we should be able to vaccinate up to at least 60% of our population. And that will require that up to about 750 million people are vaccinated in the next 2 years in Africa. And that is the target we have set for ourselves. As you are aware, Covax has agreed that they would supply the continent with 20% of our needs, vaccination doses, which we are very grateful. You don't get to 60% without going through 20%. However, the leadership of the continent, headed by Chairperson Moussa Faki, and also with the initiative of President Cyril Ramaphosa, when he was chair of the African Union, set up the AVAC, the African Vaccine Acquisition Task Team, which was designed to complement the efforts of Covax and bring our doses closer to 70%, to at least 60%, I beg your pardon. So we are using all mechanisms at our disposition to try to reach a common target of at least 60% of immunization. I mean, you just read last week that China is trying to immunize up to about 80% of its population. Europe is trying to immunize as high as 70 to 80%, and as well as the United States. There is absolutely no way and no wisdom in Africa trying to vaccinate only 20% of its population.
So Africa needs to aim higher. What is the best argument that you can think of for the rest of the world when you see the amount of vaccination ordering that has been done in the West? What is the best argument for the West to not hoard that vaccine after it has vaccinated its own population and to vaccinate Africa more? What argument do you suggest?
This is a virus that is unprecedented. It's a virus that spreads extremely quickly. I mean, we are almost just past the 1-year mark of the first recognition of this virus. And no one could have, in December 2019, imagine that up to close to 120 million people will be infected in all countries in the whole world. No one could have imagined that 2.6 million people will die in 1 year from this virus. So I think there is wisdom in thinking that if we did not immunize the entire world almost simultaneously, then we will not get rid of this pandemic, despite the fact that individual efforts in developed world may immunize their populations to the appropriate level. So we have to look at this as a collective solution. That is, we either emerge collectively from this or we will stall collectively for so long. The easiest way to get out of this pandemic is to really immunize ourselves collectively.
And which variants are you most concerned about at this point? There's been a suggestion that if the virus is left to circulate within the African population, just as it would anywhere else, it would then lead to the opportunity for variants to develop. And we've already seen some of that. Which variants and where are you most concerned about?
The variants are very concerning, but our greatest effort should be in the prevention. And in any case, we are applying public health measures and then making sure that vaccines are distributed quickly. So if we allow the virus to replicate, then there will be more variants. Those are the hallmarks of a virus that replicates as quickly as the COVID virus. So it is in an interest to vaccinate very quickly so that we stop the circulation of the virus. Then the issues of variants will be gone. Otherwise, we continue to have new variants. Today, we know the variants that have been identified in UK, in Brazil, in South Africa. But tomorrow, there will be many other variants if we allow the virus to keep circulating. And that is why there's plenty of wisdom in trying to vaccinate everybody almost aggressively, simultaneously, than vaccinating certain parts of the world, and some parts of the world are extremely left behind.
I think that the AstraZeneca is the cheapest vaccine that Africa can get its hands on. You correct me if that is a wrong assumption. But thinking about the AstraZeneca vaccine, I'm sure you've been following the difficulties it's been facing in Europe. Some European countries putting a temporary stop on vaccination whilst they wait for an update from the European Medicines Agency, even though the latest guidance from the EMA is that it is safe and the latest guidance from the WHO is that it is safe to use. What are your thoughts on the AstraZeneca vaccine?
The AstraZeneca vaccine was determined to be safe and efficacious, and we would need to review the data. I think I've maintained all along at the start of this pandemic that we should guide the response with evidence, and we should guide the response with strong science. So that science needs to be reviewed. Those evidence need to be reviewed. And we, as the Africa CDC, will be convening a meeting, an emergency meeting this afternoon with all the experts across the continent to look at the data, what we know, and then to provide appropriate guidance to the continent. So I think we should not, and I really I use this word very deliberately, should not be driving the response to this pandemic by fear. It should truly be the ability to use science, appropriate evidence to drive decisions.
But should use of the AstraZeneca vaccine continue?
So that's what I'm saying, that I think the evidence will be reviewed this afternoon by the Africa CDC, and we'll be able to make a determination based on this data, science, and that we know has been made available. Then we'll make a determination there. So I'll wait until I hear what that expert committee of the Africa CDC will say today, then we'll make a determination. But already the World Health Organization is saying we don't have enough evidence to associate the outcomes we are hearing to the vaccine. The European Medicine Agency is saying similarly. So I'll wait to hear what our experts from the Africa CDC will say before we advise member states.
OK, and then you'll advise member states. Just in conclusion then, John, I wonder if you could give us your thoughts of how far through the pandemic Africa is. Of course, it will depend very much on the vaccine rollout. But would you say that the worst is behind Africa? How would you put in context where we are right now?
No, I'll put in the context of what we are dealing with, that I would say that we are not out of the wood yet. The vaccines offer a promise for the beginning of the end of this pandemic. But that will only happen if we do two things. If we vaccinate at scale and do that quickly. So if we do what we have stated, that is vaccinate at least 60% of our population in the next 2 years, then this pandemic will be over. But if we vaccinate slowly, it will take us more than 5 years to put this pandemic behind us. And who knows? And if we do that, actually, we may be living with the real prospects of moving towards an endemic situation on the continent with COVID-19. And nobody wants to see a headline that says COVID in Africa moving from a pandemic to an endemic disease. I think that would be a terrible headline to report 2 years from now.